Month marks 60 years since the Community Mental Health Act was signed into law, but people working in the field say the act still hasn't been fully realized. Joining us to talk about this all is Mark Ishak. He is the CEO of Thresholds. Thank you so much for being here,
Thank you. Good morning.
So first of all, kind of fill us in terms of what this law did 60 years ago, because it was a dramatic shift in how we approach mental health and specifically more severe mental health challenges.
Yes, absolutely. So 60 years ago this month, actually October 31st, 1963, the late, great JFK signed the Community Mental Health Act. It was his last piece of legislation before he was assassinated. Now, this was landmark. This was the beginning of moving millions of people out of institutional settings, asylums, if you will, into community-based care. And this was the way we were going to treat people with dignity, respect, get them in the community, living where they wanted to live with the supports that they needed.
And so Thresholds history actually goes a couple years beyond that,
exactly,
right?
Just
so
a
you were
few
at the
years.
beginning of this in terms of the organization. For people not familiar with Thresholds, tell us what you do,
Great.
because you are filling a critical gap in care.
That's right. We were founded in 1959, just before the signing of the Community Mental Health Act. And our founders had a vision that people with serious mental illnesses, including people who were in institutions and people who were on the streets, deserved a place in the community to live and to thrive. You know, our tagline is home, health, and hope. And it's so much more than a tagline. And it really all begins with housing. So we figure out every day how we're going to get people housing, how we're going to get them into health care, including psychiatric health care, and then how, through all of that, we can give them hope for a better future than they have today.
And so you're wrapping them in all of the services they need. Okay, so you say 60 years after the act, we're still at a point where the goals, the vision for what should have happened has not been fulfilled. What is missing? Is it resources? Is it more organizations like Threshold? Is it community buy-in? What is it?
Yeah, so we have spent the last 60 years desperately fighting for the resources that we need. Mental health has always been underfunded in this country. There's a lot of people who've never believed that the head is part of the body, right? That physical health care and people with heart disease or cancer get the care that they deserve. But because of stigma and discrimination and the lack of funding, people with mental health challenges have not gotten the services they need. So that's been the biggest barrier. But we're working hard to change that. And there's actually so much good happening right now. You've heard about the 988 line. Everybody needs to know that number, right? So people that are in crisis have a number to call, a simple number, 988, if they are in crisis or they know somebody in crisis. And while those folks can be served over the phone, those who cannot are linked to places like Thresholds. And we have mobile response teams that can go out to meet people where they're at to deal with that immediate crisis.
And you're at a point where you're ready to expand your services.
We are. We've been very lucky. So the future of community mental health in America is called the Certified Community Behavioral Health Clinic. I know that's a mouthful, but this is, again, this is landmark legislation. 60 years after the Community Mental Health Act, we have this new program all over the country that's going to provide the funding and the resources and the support and the programs that people in our communities need. You know, so while we've always served people with serious and persistent mental illness, we have the opportunity now with this new funding to be able to support people throughout the lifespan, from the twinkle in their eye to the wrinkles that they experience in older age. And this is really exciting because we want to be a health center, and all of our partner agencies want to be health centers for everybody.
All right, Mark, thank you so much for coming in to talk about it. I feel like we are talking more about mental health, but as you say, you know, there's a lot more work.
That's right. And get a checkup from the neck up.
Yeah.
That's the last thing I want to say.
Check up from the neck up.
Right.
That's catchy. That's good.
Good. Thank you.
All right, for more information on Thresholds, check them out online, thresholds.org. They are also on all of the social media platforms. Hey, Tim.
Hey, gang.